Hi, this is Dr. Ann Lee, and today we're going to be continuing the series about breast cancer reconstruction. And this session is about what to ask your oncologist and your breast surgeon during your journey. And you want to ask these questions at the beginning because it'll be important that once you come and speak with a plastic and reconstructive surgery, you kind of want to know these answers beforehand. So you'll get the diagnosis, then you're going to be undergoing all these testing to see if the cancer is spread. So you'll be undergoing a lot of imaging, a lot of blood tests, and you may undergo genetic testing. And this is all for your physicians to understand where the cancer is at, meaning is it just localized to your breast, or has it spread to the lymph nodes or other parts of the body, because that will determine what other kind of treatments you'll be having, which can also affect the reconstructive process. So you can begin to talk about reconstruction as soon as you're diagnosed with breast cancer. So you should be asking your oncologist or your breast surgeon, when will you be seeing your plastic surgeon? And that should always be there at your appointments to ask, because sometimes it's not brought up until the end of your journey, or not brought up at all, and then you're left on your own. So you want to know all the information beforehand. So it's just like if you're going to go buy a new car or a new house, you're going to get these inspections done to your house. You're going to make sure that the car has never been in an accident. So it's the same process here. You really want to have someone go along with you to your appointments, whether that be a friend or a family member, because there's going to be a lot of information that will be discussed and you're not going to remember. So the person that's there with you at your appointments should be there taking notes, asking the appropriate questions. And then when you go home and you're well rested, then you can go through that information. So, and you have to remember, virtually any woman who has been diagnosed with breast cancer is going to be a candidate for breast reconstruction. And, as plastic surgeons, we always advocate for patients to try to have immediate breast reconstruction if possible, because it gives better results. You can go to sleep with breasts and you can wake up with breasts. So it's very important emotionally, physically, and psychologically. And also, by seeing a plastic surgeon beforehand, we're able to work with the breast surgeon and also be able to design the incisions, your mastectomy incisions. And so long are the days that, you should have this big, long scar across your chest. Now we can, hide the incisions in the fold versus creating what looks like a breast lift incision. So seeing a plastic surgeon, we bring that aesthetic part to the procedure. So again, very important to see the plastic surgeon beforehand, before you have any surgeries done, so that this is discussed with you. And also, the oncologist will tell you when you're going to have chemotherapy, if you're going to be having chemotherapy, what type. You should know if you're going to just be taking a pill or you're going to be having infusions. Also, the possibility of radiation treatments, you should ask about that. So these are just, you're going to be like a detective, and you're just going to be collecting, all this information. And then, it's going to be up to you to decide, what you're going to do in regards to your breasts. And by that, I mean some patients will decide to have lumpectomy radiation. Other patients will decide to have a mastectomy on one side. And then other patients will decide to have both breasts removed. And so it will be very important to discuss this with a plastic surgeon so you know what your reconstructive options are. And that will help you decide what to do. So I hope this little session was helpful for you. So again, I'd always tell patients to do your research, do your homework, and know what all your options are out there before you make that decision. Because oftentimes, if you rush into a decision and, then your results will not be as good as it could be if you had discussed this at the very beginning. So if you would like to see me as a patient in my practice, please call 915-351-9000. Thank you.